So we try to feel the chi. So chi is the energy or the power or the life force or the vital force which is existing in the universe. So that is existing within them, within us also, right? So always we try to understand to strengthen our energy. So that's really crucial and imperative. So now we are talking about the education and studying the courses are different from the, I think mic is there, hand mic? Hand mic is there? Yeah. Good. So we do study as a various courses related to the alternative, complementary, traditional Indian system of medicine. Studies are in fact is different from the diagnostic part. But here is the theoretical part is entirely different from. So since we studied all the things, the theoretically then how to implement in order to do the clinical practice any system of the medicine. When we look at about the Vedic system, the Indian traditional medicine or the traditional Chinese medicine, traditional Mongolian medicine, traditional Mexico medicine, traditional Iranian medicine, traditional Arabic medicine, traditional African medicine, right? The traditional Canadian medicine, traditional Australian medicine, traditional Vietnamese medicine, traditional Mongolese medicine, so on. So any system of the medicine, National Commission for Indian System of Medicine, so which is Delhi, is monitoring to all the related courses which is Indian system, Ayurveda, Naturoacupuncture, of course is the Tibetan medicine or the Sova Rigpa, and the Siddha medicine, Unani medicine, so on. So wherever we wanted to study, we studied all the things which has been originated to practice. So since there is the ancient system, the Huang Ti, Ni Ching, Su and Chipo have the conversation how to do the diagnostic part. But here is the pulse diagnosis originated thousands of years ago. The Vedic system also says you all know that. But here is the, once we understand about the clinical point, since it is the National Congress on the Acupuncture Science, but here I wanted to tell you only related to the acupuncture, but here we all know that across the globe, 160 alternative medicines are existing. At the same time, the new hundreds of the various medical systems are existing. In that, you can see that there are the few kinds of the pulses we can see. So in Ayurveda is the three doshas, Vata, Pitta, Kapha. But at the same time, only in acupuncture across the globe, where you can see the 33 different kinds of the 33 different position of the pulses. Now I should be very clear in front of you. I am not the perfect on the pulse diagnosis, and no man is perfect in the pulse diagnosis. The book says, and Professor Loya is there, he can teach to us, certainly he is the master, where the Professor Anton Jaisurya, he said the super simple is the pulse diagnosis. You wanted to become an expert, it takes decades together. So perhaps it is 10 years, 20 years, 30 years, 40 years, 50 years. Whereas some of the authors has written 32 different types of the pulses are existing. In my age, God has given me 70, 80, 90 years, so on. So then I cannot see one single kind of the pulse in my whole life. So then why I should worry about that particular pulse, which I can't see it, because certain star is coming 250 years later when the star comes on the sky. So in that way, pulse also very, very crucial. But here is the super simple way, and if the time permit me, this is not at 25 minutes is the talk. This is I can give you only the skeleton to all of you. Right. So once this is as the professor said, so this is I am the student. This is what I am also student forever till my last breath. Acupuncture is not only one part of the subject to study and implement to clinical practice. Absolutely nonsense. This is we have to study forever till our end of the life. But eventually you will going to learn 33 different pulse positions across the globe. No system of the medicine will teach you 33 different positions. But give the big applause of the hands for the acupuncture. Give big applause of the hands. Right, it's not for me. You will learn that the various systems, because internal organs having the 12 meridians and 12 pulses, Beyond that limit, there are totally on the wrist we do get nearly 22 different types of the different position of the pulses. At the same time, when the body pulses gets us a very super simple, very fraction of seconds and minute we can diagnose. At the same time, it takes sometimes it takes more than that, and we cannot predict what kind of the disease is existing through the pulse diagnosis. So during that particular time, there are the alternate and complementary to diagnose on the facial region, hand region, legs region, groin region to understand about the various pulses. But however, I am talking about the ancient system of the pulse diagnosis. But here, based on the traditional Chinese medicine, the Zhang Fu theory, collaterals, Jingulu, this is in fact is connected. Now we understand the pulses are related to expansion and contraction of the blood vessels of the heart, which is governing on the radial artery. So in this way, but the chi and then blood and body fluids we call as HNA. So to be collectively known as this is the promotion of the, where the blood vessel, the blood is circulating through the pulmonary-circulatory system. You understand the cardiopulmonary is the reason to regulate the whole body system, for the oxygenated blood should supply to the entire system of the body. The lungs are good, then the cardiac system also good, so vice versa, isn't it? Then the spleen and then the stomach is the crucial role. When the stomach and the spleen is called as the essence of the energy, that is the post essence of the energy. Mother nourishes the energy at the age of 2 years. After the 2 years till now, till our last breath, who will going to give the energy? Whatever you are taking that energy in the form of the good nutrition, that convert in the form of the glucose. From glucose, again it is converted in the glycogen stores. So from that it is scattered and distributed the energy across the body with the support of the liver system, with the support of the hepatic system. Right. At the same time, is the kidney is the major role for the essence. The essence is stored in the renal system. At the time of the birth, the parents both has given the good energy. That energy, through that we are coming to this universe. So that universe energy is transforming in terms of the blood. That's nothing but is the blood vessels. So blood vessels, the pulse we see not only on the arteries popping up, but the movement of the blood inside the channels of the viscera, and then any changes in the diameter of the blood vessel that reflect on the pulse, that's very crucial. Now what are the things is it essential to identify? So to identify it is the exterior diseases or the interior diseases through the pulse. When we understand, there are the numerous pathways to practice, but you try to understand, you feel heart touching that, you love to the subject. When you feel diagnosed precisely, then you have given the treatment. Nahi, maine kuch kiya, wo kuch ho gaya, wo theek ho gaya. Is all this bullshit, right? So whenever you feel that gratification and satisfaction, you amazing and love, that cannot be explained to anyone. The money comes and goes, the gratification or satisfaction of the patient is very imperative. So in this case, the exterior and interior diseases to be regulated by diagnosing the pulse diagnosis. Then the deficiency and excessiveness. You remember always, whenever we wanted to do the pulse diagnosis, when there is always is one is deficiency, the person is coming with the illness, then you understand there is some kind of the chi is the deficiency in the pulmonary organ, cardiac system or renal system or the intestinal system. Then you understand is the key. One is deficiency. There is somewhere is dominating that, somewhere else is excessiveness. Try to find out where is the deficiency and which organ having the excessiveness, which is the dominating. Husband want to dominate, sometimes his wife wanted to dominate. There is a conflict each other which leads to illness. So therefore the lungs having the problem, then you understand large intestine wanting to dominate, then to be balanced each other. In the similar way, spleen and stomach is the crucial. When the spleen is dominating, that's not supporting to the stomach, the spleen is not accepting the food which has come from the stomach, then the stomach is very deficiency, dominating is the spleen. So therefore energy wise also you understand, Chinese said each and every organ having the different direction of the chi flow. The chi should be goes, the lungs energy goes to the downwards direction, not should be the upward direction. The stomach energy goes to the downwards direction, not to the upward direction. The spleen should goes to the upward direction, not to the downwards direction. So it goes of the rebellions of the chi, anti-clockwise or the anti-direction of the chi goes, that reflect on the arterial system, that reflects on the pulmonary system. The mechanism of the acupuncture is, you understand, when we wanted to see that the pulse diagnosis is very, very imperative when we understand about the various concepts. Now you understand the clusal pulse, pedal pulse and polycar pulse. These are the three different pulse positions, so which we call as a chun, quan, shi. Shi means is the chi pulse. So therefore all the three different positions, when we wanted to know that, we have to place the hand in the upward direction. We have to then try to find out there are the three positions. There are the three positions. One position is called as the upper geo, the second position known as the middle geo, the lower portion is known as the lower geo. I'll tell you the point. The point is, it is regulating is the upper first segment, because the each and every artery divided into especially the three segments on the radial artery. When the three segments, the first segment you take upward, that to be known as the chest cavity. The chest cavity between the 2 points, one is the Tiantu and then Shensa, that is REN 22 and then REN 17. Midway between these two, what are the organs are existing is the lungs and heart. The lungs are connected on the right side and the left side the connected is the heart. Then you come to the below that there is the middle cavity, midway between the Shansang and the Chi heart, that is the REN 17 and then REN 6. I am audible to all of you. No? Right. So when we understand about the REN 17 to Chi high, REN 6, so midway between what are the organs are existing, that's called as a middle geo. Then you just come down to the Chi high to the Huyin, that is the REN 1. However, you understand the upper geo to be known as the REN 17 above, top of the head to the REN 17. All the organs are connected to the upper geo, that means the lungs is on the right side and this side is the heart. Right? So left side is the heart. Then you come to the middle geo or the middle pulse. Middle pulse is the middle cavity. Then you understand the middle cavity of the spleen and the stomach. And the spleen and the stomach is located on the right side and the left side is the liver and gallbladder is located. Then you come to the lower geo from the spleen REN 6 2 and the foot region K1 Yung Chuan, till that the points are, the organs are located on the lower geo. Then you understand right side is the kidney yang and left side is the kidney. Now we understand there are the three different positions. In these positions, there is the first segment to be known as a lung system, the right side. The lungs is in fact is the chest cavity. Then it including all the things which is connected to the other organ also, which is located to the thoracic region. So now we understand about the one particular region. Please, your body should be here and the mind also should be present here. Otherwise you can't understand the entire logic. But here we understand there are the, I told you, in one particular pulse you can find the three different positions. Now the first position is known as a Vikruti. Vikruti is nothing but is a superficial surface pulse. So that to be recognized as a colon, we understand. Then you just go to the middle pulse. Middle plus whatever energy is there in the lungs, that is reflecting on the middle pulse. When you go to the deep pulse, of course, is the pulmonary system. Now the pulmonary system, the lungs is here. Then you go to the deep level. Deep level to be known as a Prakruti. Prakruti pulse is always, sometimes we does a mistake. Please be listen. So this is in fact is a it's my clinical experience. Now we are finding the deep pulse. Oh, I am not finding any pulse. You are pressing to the bone. You are not pressing to the artery. So when you press to the bone and then slightly come to the surface, then you find the deeper pulse, that to be known as the Prakruti pulse, is the pulmonary system. Right? We have understand one is the surface pulse, middle pulse, and then deep pulse. Then come to the second line, that to be known as the stomach, and then stomach is the only you need to place. All of you need to place, but how to place it? I think somebody volunteer come so that I can show you very quickly. So somebody volunteer here. Because you understand only you shouldn't give the pressure. It's called as a feather touch. Feather touch itself is to recognize the superficial pulse. That's very important. When you go to the further middle pulse, you can find the energy of the blood of the in organ. Then you come to the deeper level. Now this is in fact is the patient, for example. By the way, he is not the patient, he is good friend. Right. So now we place the finger. So only we should place. This is the right hand. So through right hand, don't see the patient. So right hand, first you take the right hand of the patient and place your left fingers. So there are the three fingers, you can use it. One finger is just placed on the chi pulse, that means is the chun pulse generally. So this is in proximal pulse, you just place it. So are you getting the feeling the pulse or not? By the way, large intestine, he doesn't work, right? So now you just go to the deeper level. Good. If it's working, then you have to rush to the restroom immediately, right? So now you just feel the middle pulse and he doesn't feel anything. That means the lungs is having the low energy or the amount of the blood is low. Then go to the deeper level. Give the pressure. Pressure is the mild to moderate pressure, not the deeper pressure. Because once you get the deeper pressure to the bone, the artery gets split. The artery gets move away from that place. Then you shouldn't understand this is the way. By the way, I am giving you, when you are seeing the other side pulses like this, then the kidney pulse you are seeing one by one is the pulses, because it's not the lecture class, this just as an introductory class, you just go through, all of you know. So now I just place on the kidney energy. The kidney energy is deficiency. All the practitioners, please don't put a word to the patient, your kidneys are weak. The word kidneys are weak to the patient, then definitely that will be the great problem to practitioner, at the same time to the patient. But practitioner, he can say that he can manage. The hair fall is related to that, and then the bones are connected to that. Back pain and knee pain, arthritis are related to that. You can cross check with the patients, but you shouldn't tell that you have the kidneys deficiency. If any organ having the deficiency, we shouldn't tell that they do have that related problem. You just mention you have the problem in this region, right? I have the pain in this region, perhaps you have that. Then you can explain indirectly. Don't put a word to making the phobia. Instantly he go to the laboratory to do the investigation of the ultrasound scan. Kidneys are normal, he will blast you. Right? Because he don't want to take up the chance. Kidney failure is the failure of the life. Why you wanted to create that kind of the environment? Of course we know the knee pain is connected to that, the back pain is connected to that, right? The hair fall is connected to that, GIT related problem is connected to that. You can ask that kind of the question, but we shouldn't price that. But however we have seen, so this we can use the right hand to palpate all the three positions slowly, and then with the focus. When the patient is coming hurry-burriedly, and then immediately you are seeing the pulse is the wrong concept, and the patient practitioner is coming now. So many patients are sitting. Come Dhanadhan, I started seeing the patient immediately. Your vibrations are different and the patient vibrations are different. Then you are analyzing is the wrong concept. Right? In this way, analysis is the very crucial. Then you go to the fourth level pulse to be known as a Lian pulse. Lian pulse is related to the para arm of the uterus, para arm of the in uterus, and then yang uterus as well. So therefore right side to be known as a, you understand the right side of the pulse. Now I wanted to add up one thing which is connected to the Professor Park Javu, and who introduced the pericardium meridian. The pericardium word is introduced around 2200 years ago, but the pericardium is introduced 5,000 years ago by the Chinese people. Pericardium pericardium is not related to the outer covering layer of the heart, it is outer covering layer of the heart, at the same time is the scalp system, the brain system. The Professor Pargao said the pericardium is deficiency, then you understand all are related to the psychosomatic or the mind related disorders. When we understand that triple warmer is deficiency, triple warmer is connected to the not the upper, middle, lower jaw, it is connected to the spinal cord. The person, you understand the medical doctors, I respect all the medical doctors and investigation, it is a very emergency, it is required. At the same time, about the 80% of the diseases we can predict and understand through the pulse diagnosis. So I don't want to praise myself, but most of the patients come to us, we have to understand their respective problem. Believe it, what I am giving you here, lecture is not only for praise of me, but all of you is required. When the patient comes to you, you have to identify, since you are the practitioner, you are the acupuncture practitioner, you have to find out, because I told you 33 different pulses are there. That pulses we need to analyze, and then based on that we put your word to the patient. This problem you do have, first you increase the faith of the confidence of the patient. Once you create that, and the lifelong patient behind you, always he will come to you to take up the treatment. Now we understand about these pulses. The another pulses to be known as how to self to be taken care of the pulses. That pulses is normally, now I have seen you, this is the pulses is, we have to see like this and then like this. But if we suffer ourselves, how to predict? Because that particular time we are going with somebody, Atama president here, when we are going to him and then take the treatment. So that particular time is not that. So I am super qualified doctor. So sir, you apply this point. You apply this. You forget about yourself and surrender your whole system to somebody else to take care of it. When the person is there, when the person is not there, that particular time it is very, very crucial to analyze the patient, and not like this. This is in fact is the wrong concept of the diagnosis once we are placing like this. So therefore it is required to understand. So all the ourselves when we are sick on that particular situation, place in this is the position to understand about the our gratitude of the pulses. Then you just place it like this to understand what quality of the pulses is there. So that easily will going to predict your problem. So acupuncture is not only the existing problem we can understand, at the same time the future predictions also can be possible. If the patient says I don't have the problem, be happy. Don't tell you will get the problem. That is the wrong concept. We are not a scared healthcare system. We are the happy, healthy way of making the healthcare system. Is not making the phobia to any point of the time. When the cancer he doesn't know, he happily live the life. When they come to know the next moment, it gives is the serotonin, melatonin and dopamine will stop secretion. Then again it releases the unwanted chemical substances which causing the miserable life. Right? So this is you just go through. This is not the super simple. Just you go through. The another pulse I told you. Tumai and Renmai meridian also existing. This is the first pulse to be known as a Renmai. This is the second pulse to be known as a this is known as a Tumai. Tumai and Renmai. There are the 4 points and keep it in your mind. All the male and female problems can be regulated. The 1 point to be known as a Lichu, Sahai, Huxi, Shenmai. There are the one is LU7 and K6. SI3, UB62 is this called as the extraordinary vessels communicating point in our body. When the ventral side of the body is good, then the dorsal side of the body also good. There are the 4 points are regulating overall. So therefore the Renmai, Dhumai can be regulated. So what time to be better time? However the patient whatever time comes, that's the better time for him. But however the right time is the morning time. So midway between the 5 to 7 is after the bowel elimination. That's really is the ideal time to take the pulse diagnosis. So after the pulse diagnosis, I think Professor Loya is here, so he can give me some clarity after that. So even once we diagnose in the empty stomach, then later can be given the treatment immediately, or the after breakfast to be taken the treatment. I think the Professor Lohia is going to give the answer for this. But however the diagnosis will be crucial, especially in the morning time is always is good. But by the way, I see around the night 11 o'clock, sometimes 11:30. I complete my practice, sometimes it's 12 o'clock night. So even the patient comes at 11 o'clock, I need to see what is the quality of the pulse. Remember, stomach, when the person comes to you in the morning, in the empty stomach, that means after this and this passing, so that particular time, the bladder energy is weak. Don't consider that bladder is deficiency. When the person is coming is too hungry, so that time stomach energy is weak. Don't reflect and consider that his stomach is deficiency. Of course, until he don't have the problem. Relate. See, when the person is one particular illness, for example, stomach having the cheese deficiency, so that particular time we try to understand what are the signs and symptoms the patient get and tell all those problems. The muscles and fleshes is controlled and regulated by the muscular system through the stomach itself. So therefore the muscular having the deficiency, isn't it? When the GIT related problem, stomach is storing the energy, not passing to the some other organ. So therefore stomach is the stomach sun is the large intestine. The stomach is not pushing the energy to the large intestine. Therefore the colon related problem. So therefore the bowel related issues. So on you can explain when the stomach having the problem. You understand the stomach energy starts from the chanchi, that is the below the pupil of the eye. So that particular place, you just see that the vision related problem, the facial related problem, the breast related problem, of course is the abdominal related issues, of course is the knee pain, so on. When the person get the excessive dreams, so that also the blissful dreams or the monsoon dreams is always is good. I too like it. But when the horror dreams are coming, then could be the reason his stomach is not descending downward direction, it's going to the upward direction, because the range of the motion of the eyes, it rapidly gets the movement in the night, which causes the excessiveness of the dreams, because that is stomach malfunction, which because the chanchi, the point is stomach one starts from here. But the chanchi, the Chinese names is coming, then I wanted to tell you within 10 minutes I have given the 361 acupuncture points in the Chinese names. Chengchi. So we call as a Chingaminga Sansu Mi Chingachu Chai Chu Chengchi. Yang Chengachina Chengachanga Pi Yang Fu Yang Kunulan Fu Shan Chenamai Chinaman Chingo Shugo Satambo Chayin. So therefore all the Chinese names are very crucial. Each and every point is meaningful. Madam, I think little more time is required, otherwise you can see my slides. The infants having the problem. So related to that, the infants is coming to you at the age of the first day of the 1 year, 2 years, 3. I am the pediatric acupuncturist. Renowned in Bangalore is the pediatric people. All the children comes to you, me for the cerebral palsy and many more related disorders. So that particular time you understand the pulses are more for the children. You cannot predict. It is the tachycardia. It's not like that. But however, this is we have to palpate and then always see what is the rhythm, what is the quality, what is the tension, what is the force, and what is the volume of the each and every pulse is very imperative. That we need to learn how to learn. It takes decades together. Whenever the patient comes to you, whether you diagnose or may not diagnose, start seeing the patient. All the 12 positions you keep seeing the pulses always is good. Now this is the abnormal pulse, hollow pulse, tympanic pulse, soft pulse, deep pulse, and then further hidden pulse, short pulse, long pulse. So this and all, in fact, this is in fact is you forget everything. Because I told you 28 different qualities of the pulses is not super simple. It's not the cup of the tea. We can learn. Some author or the masters is called as a didactic errors. It causes didactic errors. It causes. If I am teaching to you, I may tell you something wrong, perhaps like this. But what is required? How to identify? So one thing is the super simple level. Keep it in our mind. So one to be known as one is the exercise, you just place it the finger, the pulsation, getting the palpation or not, that much we need to identify. Initial stages, later is a slippery pulse, and then hidden pulse, hollow pulse, rapid pulse, accelerated pulse, weak pulse, and knotted pulse, round pulse. Forget all these things. This cannot become the master. It takes longer time. But however, so it is palpating, then it's good. If it's not palpating, that's considered as a deficiency. Right. In that way, once the large intestine having the deficiency, that particular time you try to understand which is the mother for the large intestine according to the 5 elements theory. Stomach is the mother. If the stomach is deficiency, which is the mother for the stomach? That is the small intestine. So therefore, one is deficiency, which is the excessiveness that is predicting, or the grandmother is controlling that you release to grandmother to get the grandson regulation. So that's in fact is the concept of the Shank cycle and co-cycle. I think this is in fact we try to understand when the lungs having the deficiency. So that particular time, which is the mother for the lungs having the problem is not related to the lungs, perhaps some other organ having the problem. So which is the mother for the lungs? Spleen. Spleen is the production of the phlegm, and then the container is called as a lungs, where they stored all the unwanted substances in the pulmonary system, which causing the phlegm or the shortness of breath or breathlessness or asthma. Asthma is not related to the lungs, it is related to the spleen. Asthma is not related to the lungs, it is related to the kidneys. When the kidneys is not receiving the energy of the lungs, which causing the asthma. When the spleen is not supporting to the lungs, which causing the asthma. Therefore, we try to understand where the energy is excessiveness, for that is what is required. Shunt cycle and then co-cycle. In fact, I have written how there is equivalent to each and every acupuncture point. For example, then LU7 is equal to LU5 is equal to K7. Spleen 5 is equal to LU9. So therefore, each and every command point having the importance of the connectivity. So one is the excessiveness, how to drain out that to regulate the other system. This is in fact is the Shunt cycle, co-cycle is the mother and is the supreme mother. In order to treat for the single treatment, I like that the people who practice as a clinical acupuncture and classical acupuncture, both are different concepts. Now we wanted to know, we wanted to save the needle. We don't want to use needle, also use the FDA approved needles. In India we use the substandard needles are not good, but always you remember internationally recognized needles to be known as a FDA approved needles. So in this way, once we understand about the Shunt cycle and co-cycle concept, based on the transfer the energy from one organ to another organ. See, now the patient will be, how will be cured? See, healing properties are not in our hands, remember. So this is in fact the Almighty God having the ability to give the energy, to give the healing power to that patient itself. But before stepping to the patient, we all, anyone is patient, that particular time is you try to ask to yourself, to the patient, or the patient himself ask what would be the reason to cause the problem of myself. Try to understand the etiology, try to understand the pathogenesis and onset of option, the patient itself to recognize what would be the reason to cause the problem. So therefore we try to make them to understand. Then we wanted to understand about the wind, darkness, dryness, coldness, humidity. So this is connected to the 5 elements theory as well. You can go through all these things. Of course, there is the Western perspective of the acupuncture. I think Dr. Zarina will going to take care of that. But dermatome, myotome, sclerotome, enterotome, syndicome. This concept along with that we understand. Yeah, just a second, I completed. Thank you very much. And shamanic acupuncture, I remember here Professor Dr. Siddiq Jamal and Fazlur Rahman. So we salute to him, and they have given a lot of inputs for the electromagnetic energy, how to be taken place by giving the pressure to motivating by using the command points as well. So kind of you, thank you for the National Acupuncture Congress and also the Orientation Academy of the Allied Sciences and also Alternative Medicine giving the opportunity. So kind of you, thank you.